About the economy, CD appreciation, and related matters. And today, one of the big events that will shape the way our economy is run, how we do things, is happening. The Ghana Horticulture Expo is happening this morning at the AICC. If you want to do anything in agric, export, import, if you want to venture into agriculture, that's your platform to be. And the president will be speaking, and the industry expects him to say a lot of things that will give the industry the boost. So, conference center, let's meet there today. And it's brought to you by Phage Gepa and supported by Joy Business. I'll start with the daily graphic. Nurses strike. Government committed to dialogue. This is the Minister of Health, Kwabena Mintah Akando. Chamber of Licensed Gold Buyers secures EPA fee waiver. This is to give them a boost as the gold board shapes up and tries to consolidate the gains in that particular sector. Explore investment opportunities back home. Diaspora Investments Forum speakers advising Ghanaians and people in the diaspora to explore investments back in Ghana. And more data for same price from July 1, Sam George assures. This is following his press event yesterday. And timber racketeers invade Abutia Game Reserve. It's on the back page of the newspaper.
We'll get to the more data bit later on when we get into the details. But the Economic Times for this morning says new fuel levy. Opposition stifles as stakeholders debate the remnant, and Islamic banking serves interest of all faith. That's Professor John Gachi. Ghana aims to replace raw gold exports with refined bullion sales. All on the front page of the Economic Times.
If you go to the news center, government seeks to replace nurses, midwives with retirees. Nurses strike, frustrated patients lament delays at hospitals. Gold board cured lapses in previous system. This is Sami Jemfi, the CEO, speaking. Minority proposes solutions to deal with the energy sector. Kujo Oponkroma is leading that conversation. And OSP wrecks SML's systems. GRA to lose millions in revenue. That's the headline on the SML related matters. And Cocoa Board seeks BOG's helps to save local LBCs, Dr. Randy Abbey. And you know the thing he's asking for us to use 3% of the reserves to support local LBCs.
To do what?
To buy cocoa and to operate and ensure that Cocoa Board is able to deliver on its promise to Ghanaians. That conversation started years ago. There are people asking for some of the reserves to be given back to industry at lower interest rates, patient capital to drive growth. Now, Randy is pushing from the Cocoa Board angle, and others are.
That conversation, I do not think it's right for this year.
Not for this year,
Not
yeah?
for this year. Maybe not for next year.
Okay.
Maybe for 2027, 2028, we can start having that conversation. When we are very disciplined over a long period of time,
then we can do that.
We can have that conversation.
Okay. Akosia Menu has written an open letter to the Vice President from scrutiny to siege, and she's asking the Vice President to speak on the Chief Justice matters.
Okay, that same story is on the front page of the Ghanaian Publisher. Speak for Tokonu, Akosia Menu to VIP. GLIS sends SOS to IGP National Security over safety concerns, and that's the Ghana Lebanon Islamic Secondary School in Accra. Gold Board will clean up mess in the gold trade, Sami Jemfi. Oil cartels, OSP, National Security go after SML, destroy revenue monitoring system, and minority tells government to change posture towards striking nurses.
And my Joe Online?
Sure.
Government making backroom efforts to end nurses strike. This is Felix Kwachio Fosu speaking. Mahama to announce tough restrictions on public official specs. This is the same Felix Kwachio Fosu speaking. 3 SML directors picked up in OSP search as part of corruption probe. And over 2 billion Ghana cedis cost too high. Government defense delay to implement nurses deal. And some people are saying only 2 billion? Too high for the health sector, for nurses to ensure patients are taken care of. That's one of the big stories this morning. Nurses strike, government not backtracking. We are protecting the economy from collapse. This is Kwacho Fosu. And Minority Caucus proposes solutions to deal with energy sector debts. Konfanochi HR manager's office locked by unknown persons demanding his removal. Those are the stories on My Joy Online. You can go to My Joy Online for more stories. Now let me take you to City Newsroom. .com. My stance on Galamsey not compromise. I'll sustain it. This is Ken Ashibe, former Chamber of Telco's boss. Now he's the Ghana Chamber of Mines CEO.
And if there's any position that allows him to do that, is
Yes.
this position.
Yes.
He's a representative. I mean, he's the chief spokesperson, more or less, of the mining companies.
Yeah.
And they're against illegal mining.
Yes.
So that's it.
And the Chamber of Mines is denying political influence in leadership changes. MOAG to meet NLC over conditions of service today. So nurses, MOAG, TUTAG, UTAG, all those associations are asking for better conditions of service. Mahama deserves apology for Wuntumi's offensive comments. This is Dr. Yue Friye. And Ghanaians deserve unlimited monthly data, not just bigger bundles. This is Davis Ansa Opoku speaking. So those are some of the headlines online. Winston, should I start with the details?
Yes, let's get into the details.
I want to start with the BECE and give some numbers before we go to nurses and data. About 603,328 candidates are poised to sit for the 2025 BECE for schools and private candidates. It's starting today and it will conclude next week, June 18 on Wednesday. So instead of Monday to Friday, now it's Wednesday to Wednesday. Now, this year's number of candidates represents a 6% increase from 2024. So in 2024, the number was 569,000. Now it's 603,000, almost 45,000 more candidates. Now, WAEC announced the figures today, revealing that approximately 297,000 are males and 306,000 are females from 20,395 participating schools. So those are the numbers. 603,000 of future leaders.
Yeah.
We need to do better and plan better for them.
Of course, that's something that is expected to be done. I mean, you're looking at 603,000. You're looking at you need to find out spaces in grammar schools and in our technical schools. So how many of them are likely to go to technical schools? What percentage of children do we need in going to go to technical schools, and how do we get them into technical schools? It's what we should be thinking about. You see, we just don't wholesale say, okay, that's the end of it. We must be strategic in deciding that, for the country's future in the next 20, 30 years, this is what our future must look like. So these are the kinds of human resources that we need. You train them.
So if we say that the housing deficit is it 200,000 or 2 million? If we say the housing deficit is 2 million, you need people who can help build 2 million homes, carpenters who can help build 2 million homes, painters, tilers, metal fabricators. All these people, we need them, and people who work with glass and all those things. How are we training them? If we say we need a lot more roads, we have about 74,000 kilometers of roads in this country. What human resources are we going to, if we want to be food secure, the AI space, technology, everything.
We must be planning.
Healthcare.
We have to plan. Yes,
we have to plan. Now, talking about healthcare, page 8 of the news center, nurses 2 billion Ghana cedi demand threatens economy. This is according to the government. Now, the health minister spoke yesterday. Deputy Minister of Finance also spoke yesterday. And the story says the health minister, Kwabena Mintah Kando, has issued a stark warning that the full and immediate implementation of the Ghana Registered Nurses and Midwives Association demands could have dire consequences for the national economy. And backing the health minister's assessment, the deputy finance minister Thomas Nyakwampim disclosed that the proposed conditions, including a 13th month salary, unpaid allowances, fuel and medical provisions, rural incentives and others, would cost the government over 2 billion Ghana cedis in additional expenditure. And this is the reality. Now, he says, and I quote, the reality is that we have over 120,000 nurses, and implementing the current conditions of service they are demanding will add in excess 2 billion cedis to the compensation budget. And we are not ready for that now.
Listen to what he said. I mean, just listen to the Deputy Finance Minister.
Well, the reality is that we have over 120,000 nurses, and the implementation of the current condition of service that they are demanding will have serious consequences for the budget. In fact, if we fully implement it, we are going to add in excess of 2 billion cedis to the compensation budget. We have all committed that in our resolve to reset the economy of this country, we must maintain a 1.5% primary balance surplus every year in order to bring our debt levels to sustainable levels. And so it is important for us to manage expenditure.
So that's Deputy Finance Minister Thomas Ampemnyakun there making that point. So, well, Kojo, one of the things you look out for is that government has a chance to, present a mid-year budget review.
Yeah.
In the mid-year budget review, we've talked about how, for instance, we've been, gaining a lot from the sale of our commodities.
Yep.
Is there a possibility that we may be getting in more money than expected, or we may actually would have to via certain expenditure items? I think that, look, there are certain things that, there's certain discretionary expenditure items that if you really want to negotiate, how much of it are you prepared to pay?
Exactly.
Now, you say that it will throw your budget off. Is it possible that you maintain the budget and still get these people to go to work? As opportunity cost, for instance. So here, one of the best ways, or most of the time, our capital expenditure is some 32 billion Ghana cedis. Is it possible that we reduce this capital expenditure by, let's say, even 1 billion and tell the nurses, take this while we negotiate and make other payments next year? Instead of saying it will throw our compensation budget, and out of gear, can we re-engineer our expenditure items and make provision for that?
Are there new and better ways to even
Yes.
deliver that, the capex we've budgeted for?
Exactly. So, for instance, when it comes to IGF of say teaching hospital that I know, IGF of teaching hospitals, there's about 15% could go into compensation of employees. There's a formula for the sharing mechanism. Can you vary it to ensure that part of it could go into, say, payment of certain allowances?
Exactly.
If that cannot be done, for instance, how do you go about it? Re-engineer the system to say, this is what I intend to do. But to say, wholesale, let's start next year. That could be problematic. Okay, let's not just sit back and say, this is what I can afford, and that's the end of the world.
Places that we can take money from and do things differently in the infrastructure space. For example, we spend millions getting vehicles and machines for drip. Can we then say, because we have those assets, if we are awarding any contracts for infrastructure, government owns plant and equipment, so some of those should be used to do some of these things. The whole of government approach, this, that.
And you're talking about goods and services, for instance. Goods and services budget for 2025 is 6.9 billion. What percentage of that can you use? Can you say, because of this, we're going to hold on to this. We're going to hold on to that. And then we'll use the savings to actually take care of this.
And we all know there are a lot of wasteful expenditure in some of these things.
There are. So let's not just throw our hands in despair and say, oh no, we can't do anything about it. We can't do anything about it. And let's wait till next year. Now, when you wait till next year, and that's why I say this thing all the time. Look, one of my friends, Untifafa Kwasi, sent me a message that says that if you're unhappy with multimedia, you see you are going on strike, if I am happy, I'm happy, and I go to the company based on the service I render to the company can say, we would look at you and then decide that it would increase your salary. If the company thinks that I am not important to the company, they will fire me. They will tell me you can go, and I will go. That's if I want to go. I haven't said I want to go, but if they say this is what they want, and now that we have decided, listen to this. Now that we have decided that in the meantime we're going to be getting retired nurses, aren't we going to pay them? Where are we going to get the money from to pay the retired nurses? I haven't heard them saying they're not going to pay the nurses their salary because they're on strike. So where are we getting the money from?
Maybe the retired nurses are going to work extra national service without any compensation. One thing I'll be looking out for? New vehicles bought by the states for functionaries. If we don't have money for nurses now, and I see any new vehicles being bought, then it shows that we don't value lives and we don't value our people.
I'm sure that government. Felix talks about how government is quietly backed on it, but I think the negotiation has been poor. The government's negotiation has been poor. You make you tell them something. This is how you want to do it.
Yeah.
And then we can come back and say, let's do this. Anyway, one more story, and then we get for.
Yes, the other big story is the data story. More data for same price from July 1. Sam George is assuring. Yesterday he had a press event, and the story says many Ghanaians will from July 1 enjoy more data for the same price as part of sweeping reforms announced yesterday by the Minister of Communication. The minister explained that engagements with the country's 3 major mobile network operators, Camcom, which is MTN, Ghana Telecom, which is Telecel, and Airtel Tigo 80, had resulted in a 10 to 15% increase in data bundle values without any price adjustments. But some people are saying that is not enough. We want unlimited data.